Conscious Breathing for Radiant Health. Hi, I'm Richard Rust and I'm here to take you through a few simple steps for doing the exercise of conscious breathing. So number one step is, if you can, if the weather allows it to happen, to be outside, especially in a backyard somewhere where there's lots of plants and trees, things growing, so that you can be imbuing your inner self, your inner body, your inner system through your lungs with all this energy, this fabulous, wonderful energy, and of course the fresh air. You can do this indoors, and ideally if you can be outside, that's great. The other thing is, if you are outside on a warm and sunny day, it's nice to be able to have a bit of skin exposed to the sun so that you can also absorb some of that ultraviolet radiation, which is, in a good way, it's all been shown to produce extra vitamin D and also to supercharge your mitochondria, your energy producing units inside your cells, to produce more energy. So that's a good thing. If it's in the middle of winter and it's a little cold because of the temperature and a particular southerly wind, for example, then obviously dress up warm around your torso and arms. You can even put a hat on and your legs as well. And the one thing I would suggest, though, if it's possible any time of the year, that when you're doing conscious breathing, that you actually have bare feet. The bare feet connecting with the grass or the earth or the ground helps to discharge positively charged ions, which are like free radicals or reactive oxygen species, sometimes called, and helps you absorb negative ions, electrons, from the earth energy itself. And so this is useful for reducing inflammation, increasing your sleep or the quality of your sleep, and also for eliminating extra joint and muscle pains in your body. So it's a really good thing to do. It's called earthing or grounding, and you can Google that and find information about earthing or grounding. That's why it's good to do it as part of a breathing process externally. The other thing is to have a flat seat or a flat chair. So you see I'm sitting on a bench, a wooden bench here, which is flat, and because it's a bench, it has no back support. So ideally I want to be sitting upright on my sit bones on the flat bench. The problem with many chairs is they're raked, so they have a slope, so you sit on it, your body slopes backwards towards the back of the chair, and that's not ideal, because if you do that, do this process for a few minutes in such a chair, it's going to cut the circulation off to your legs, and also going to be not ensuring that your spine is in the best position. So sitting on a flat chair or bench is ideal. And when you're sitting on that flat surface, it'd be good to feel your sit bones. So you can move around a little bit to feel the sit bones on the chair, on the seat, on the surface. And so in that position with the flat seat, and you want to just arch the lumbar spine just a little, so arching it forward, so you're recreating your lumbar curve. And also, to ensure the straightness of the spine, imagine a cord around the crown of the head, lifting your head upwards. As it's lifting the head upwards, it's going to tilt the chin down and open up the back of the neck. And so that's not completely losing your cervical, your neck curve, but it's helping to accentuate it and helping it to be more open, so that the flow of energy up and down the spine flows really nicely, particularly the flow of cerebrospinal fluid, which the spinal cord and the brain is surrounded in, and which is a very life-giving and energizing fluid and force in the body. So having positioned there, you want your feet flat on the ground, and the feet can be either even, both sides that way, or if maybe you've got some ilium rotation issues that cause you to feel more comfortable with one foot forward and the other foot back, that's fine. The most important thing is that your spine is in an erect position with the correct curves, and you can then allow the energy to flow there with your feet connected to the ground. And so the first thing we're going to be doing, well, what we're going to be doing is taking a deep breath in, holding that breath for a few moments, and then letting the breath go, but not just letting it go, but actually controlling the release of the breath. So, and ideally when we're doing conscious breathing for Radiant Health, we want to be breathing in through the nose, holding it, and breathing out through the mouth. So if we just start, and I'll kind of guide you as we go through the process. So if we take a deep breath in through the nose, and then hold that just for a few seconds, and then slowly out through the mouth. Now you'll notice a couple of things that I'm doing there. Firstly, as we take the breath in, what we want to be doing is taking a diaphragmatic breath in. So the diaphragm's the big muscle that divides your thoracic cavity from your abdominal cavity. So when the diaphragm contracts, it goes downwards. So as it goes downwards, it pushes the abdominal cavity outwards. So we want to be ideally breathing as we take the deep breath in. We want the upper part of our abdomen to be expanding, which is a sign that the diaphragm's pushing downwards. So a lot of people, when they try diaphragmatic breathing, they kind of have the look of being pregnant, 9 months pregnant. So they go this way, so you have a big bowl of a belly there, which is okay, but what that tends to do is it reduces the tension and the tone of your abdominal muscles, and a lot of people with low back pain, this is a major problem, is that they don't have enough tone in their abdominal muscles. So what we want to try and do is maintain a bit of tone in the lower abdomen, and as we breathe in through the nose, we want to just expand the upper abdomen here. So I don't know if you can see my fingers there, but we go, and that pushes out that way. So in relation to what we talked about with diaphragmatic breathing and using the upper abdominal, I'm just going to go on a profile here on a side-on view so you can see the upper abdominal. This is my solar plexus area, and when we breathe in with using the diaphragm, and then hold the breath, and then slowly out, as opposed to doing the whole belly that way, which makes you look a little bit pregnant and compromises the integrity of the abdominal muscles. The upper abdominal is much better. So just breathing in and then slowly out. And then we hold the breath. Now, if you're first taking a breath in, or even if you're taking a deep breath in using your diaphragm, what can happen is you sometimes expand the breath even further by tensing and expanding your chest and your rib cage, so that it goes something like, and that's not the position you want to be holding your breath in, because that creates a lot of neck and shoulder tension, and actually strangely or interestingly stimulates your sympathetic nervous system. It compresses parasympathetic nerves and stimulates your sympathetic, which is your stress response, your what people commonly call now as your fight or flight response. So we're trying to go the other way. We're trying to stimulate your parasympathetic nervous system, which is your relax and digest and repair response. That's what it is. So ideally, when you're having a good night's sleep, you're in parasympathetic dominance, whereby you're healing, repairing, and restoring. And so, if you take a deep breath in, and you find yourself like this, just check in with your shoulders to make sure that you drop the shoulders so you're not holding that extra neck and shoulder tension, okay? So we're going to do this again. So breathing in, I'll breathe out first, and then I'm breathing in. Make sure the shoulders are relaxed, and you're going to hold the breath for a little bit, and touching the tongue to the roof of the mouth behind the front teeth. And after a few seconds, then slowly out through the mouth, release the air, but in a controlled way. So just to explain a little bit more about the exhalation, what a lot of people can do is when they take the breath in, they hold their breath for a period of time. They hold it too long, so that when it comes time for the exhalation, they've got nothing left. Their CO2 levels are too high, and they have to breathe out in a gasp. So holding the breath in and holding the breath, and they go, ah! And if you let the breath go like that, it's all gone, it's disappeared. The breath is wasted. So what the point of holding the breath is to let the oxygen that's diffusing through the lungs into the blood, and then the cellular part of respiration, so the blood releases the oxygen to the cells of the body. You want to maximize that process by holding the breath, and then still controlling it, let it go slowly. So your breath retention should be comfortable enough so that you can release the breath slowly. And yoga and pranayama, which is the yogic science of breathing, prana meaning life force energy, and yama meaning control or discipline, or like literally the reining the breath. You want to be the normal ratio of breath, the breath cycle is 1-4-2, and with 1-4-2, say if you breathe in for 5 seconds, then a ratio of 4 for holding the breath, that's 20 seconds breath retention, and then the exhalation should be 2, which is for inhalation of 5 seconds, that'd be 10 seconds exhalation. That's probably a bit too ambitious to start off with. So the number one thing you want to start with is maybe a 1-2-2. So we breathe in for 5, hold for 10, and exhale for 10. So I'm going to demonstrate that now. So breathing in with the upper part of the abdomen. And then out. Now, I wasn't specifically counting the seconds as such, so as long as you're approximating a 1-2-2 ratio, that's a really good thing. And there was something about the exhalation, the way to control it, apart from just holding your breath for too long, so you have to let it go to get your next breath in, is to exhale the breath through the mouth, tongue to the roof of the mouth behind the 2 front teeth, out there. Exhale as if you're whispering, making a whispering noise. Like when I'm whispering, it sounds like this. And so if I'm just breathing out, that's what I'm constraining or constricting the throat, so it sounds like a whisper, just like that. So we'll do it one more time. So breathing in. And then out. Good, that's good. And so one of the other things you can do at the end of your exhalation, even if it needs to go a little bit more than just the 10 seconds, is to actually do a little bit of a cough or a pushing out of the what's called the residual volume of air in the lungs. It really empties the lungs out. So I'll demonstrate that in the next cycle. So we breathe in again. Vacuum inside the lungs now, all the air's gone, so we breathe in. And out. So you can continue that process probably for about 5 or 10 minutes. 10 minutes of conscious breathing is just an excellent way of training your breath and your nervous system to just be more present in the moment right now, and to suffuse your internal cells and your internal fluids with massive amounts of energy and oxygen and just life force. So those are really good things. I'm going to do a bit of a demonstration now of the 1-2-2 ratio, building up to a 1-3-2 and then a 1-4-2. So I'll do a couple of rounds, and you can breathe with me if you like. It's fairly simple. As long as you're following all the steps that we've covered so far, it's a fairly simple and energizing and powerful process for increasing your internal radiance. Okay, here we go. So breathing in. And again. And again. again. One more. Cool. So, and even just from that little bit of breathing that I've been doing with uninterrupted with a lot of speech and talking, my brain feels different. I feel more expanded sense of awareness. I'm aware of the birds tweeting. I'm aware of the flickering of the sun through the branches and the dappling of the light in the shade. It's just an experience of being more present and more calm and relaxed and settled in my system. And it's almost like this exercise, when I do it, gives my system space to be able to be and expand and heal. And so hopefully, if you can follow these simple steps, you too will enjoy some of the benefits of increasing your internal sense of radiance, radiant health and vitality. Your immune system will become stronger, you'll sleep better, you'll experience more moments of simply being present in the moment and witness to your life, which is a thing of beauty and a thing to be grateful for. Gratitude. Thank you.